Sure. Lumpectomy is a very nice treatment option for breast cancer. It requires taking out the tumor itself with some surrounding tissue, and that's called a margin. It's very important to get the whole tumor out, obviously, and also to have a nice piece of tissue around it, but not too much, because you want the breast to look and feel like a breast when you're done. It's a nice option. The other option, of course, would be mastectomy, where you take all the breast tissue out, usually reconstruct it. But the reality is that over 70% of our patients choose lumpectomy with radiation. It's interesting. People choose lumpectomy because A, they get to keep their breast. B, they look and feel like themselves. C, it's much less surgery. D, they have less anesthetic, a much faster recovery. And in this day and age with the issues with jobs, they get back to their job faster. When I perform a lumpectomy, it's very important to get the whole tumor out and a margin of tissue around it that's negative for tumor. Because in our minds, that means we got the entire tumor out. Tumors sometimes are mixed. Sometimes they have invasive cancer and precancer. And the issue is the precancer particularly can be on the outside of the tumor. You don't feel it, you can't see it with the naked eye. So after I get the tumor out, I put 6 different color inks on that specimen. I mark it with these charms that tell me which margins are which. And then I take an x-ray of it right in the operating room. And that x-ray is done with the Coupe-Tec, and it looks beautiful. And then I can tell how close each margin is. I can actually tell if I've gotten the specimen that I need out, because many of these cancers we can't feel. So you're using guidance, radiology guidance, to find these. And it's very reassuring when you've gotten the whole tumor out. So particularly with the Coupe-Tec, the Mozart Coupe-Tec, particularly with the Mozart Coupe-Tec, we're able to see a photograph of the specimen itself, so I can see all the different color inks I put on and the charms. And then there's a very fascinating piece to it where the machine actually goes through the piece of tissue in small increments and it can actually measure for me, or I use it to measure the distance from the margin that I see as negative down to where the tumor is. There's a huge benefit to not taking a patient back to the operating room at any time. So the complications that can occur with a lumpectomy include the fact that sometimes the margin is positive, meaning the edge of the tissue has cancer cells in it. We never want to do that. We never want to leave that cancer cells behind. So if I can take an x-ray in the operating room, I can assess radiographically if I'm close or not. If that pathology comes back a week later and tells me that there are cancer cells at the edge, I have to call my patient and tell her that we really need and should go back to the operating room to clean that edge up. So the benefits to having the Mozart Coupe-Tec in the operating room is that I get to assess that I took out the right tumor, that I have all the calcifications or the little white dots on the mammogram that I was after. I get to see how far the tumor is from the edge of my specimen. And then I also get to assess it radiographically to see how far it is from all the edges. Because the picture generated by the Coupe-Tec is fascinating. It gives us slices through the specimen so we can see and assess how far the tumor is from the edge. That's a good question. I do think it's important that patients understand how much work we go to keep that specimen oncologically pristine, meaning, you know, we work, it's not just like we go in and take out a lump and you're done. There's a science to it. There's a technique to it. These details are very important. And when I see a patient for a second opinion that hasn't had this, I always know. Because when patients get positive margins, they want to get second opinions. I actually think now in 2020 that it's very important to ask your surgeon whether this is available for them in the operating room. Because the shorter you're on the operating room table, the better it is from a bleeding risk, an anesthetic risk, an infection risk, and quite frankly, a blood clot risk. So you want to know that your surgeon is being as precise as possible. I personally feel now in 2020, this should be standard of care.